So on this initiative, there is a large point of diet and nutrition part. So how do you see and what do you suggest on this part?
See, increasingly researchers are showing that if a individual doesn't consume healthy diets, by healthy diets I mean this is what World Health Organization has defined, that among there are 8 food groups for young children. About of those 8 food groups, at least 3 to 4 food groups should be consumed on a daily basis, and for adults there are 10 identified food groups, out of which 6 food groups should be consumed, which in effect means that the plate should be nutritious and should have all the colors of, we say, the colors of the Indian flag. So it should have white, it should have green, and it should have orange in the food that we eat. Unfortunately, our eating patterns today has undergone a sea change, and we are seeing increase in non-communicable diseases not only in urban pockets but also in rural hinterlands. That in effect means that the dietary patterns of individuals have changed towards more convenient foods which are rich in saturated fats, salt, sugar, which makes them extremely unhealthy. And because of the food and gene interaction, what happens is new lifestyle diseases, so-called lifestyle diseases or non-communicable diseases are showing up. Cases of cancer, as you can see, is growing up by leaps and bounds. So all of these point out that we should have a very, very conscious effort towards eating healthy diet. So now the mantra is, and this is also what the ministry is now increasingly saying, to remain healthy. There are 2 mantras. One is eat healthy, the other is exercise. And they are saying exercise at least 300 minutes, nothing less than 300 minutes in a week. So these are the 2 mantras to remain healthy. It is not one or the other. So what I would say that healthy diet is very important. We call it, it should comprise of all the necessary nutrients. It is very essential for an individual to stay healthy not only during young age but across the life cycle. That's number 1. And number 2 is, in spite of that, because interventions such as deworming and others should be, these are more prophylactic interventions. They are done on periodic basis just to ensure that the load of these worms or these elements within the environment remains low. So these should also continue and complement the intervention or various food-based interventions which are strongly being advocated for healthy lifestyle.
So you have told about the intervention tablets. But how you could understand the people that we need to have a diet pattern we should follow on that pattern. How the awareness is doing.
So basically, each of the departments, they have their strong community mobilization strategy. For example, I can give you the example of Women and Child Development Department. They have designed 2 mascots. One is called Tiki Mausi, who is an elderly woman who gives messages around socially good practices. For example, eating healthy foods and others to the community. And the other is a younger mascot, because now we are seeing increasingly youth. That was what Madam also said, that youth are being addicted to unhealthy food patterns. So Kuni is the youth mascot who gives the messages around healthy eating, healthy lifestyle to the young and the youth of this state. So a strong community mobilization strategy using these 2 mascots. Along with that, there are active interactions with several stakeholders. For example, Panchayati Raj members, self-help group members. Self-help groups, as you know, within Women and Child, they supply the take-home ration. So they are also part of this entire communication or community mobilization initiative, because they are also very important stakeholders. So engagement with them, sensitizing them about some of these key interventions around food and eating is something which is going on at scale within the state.
What target you have set and what message you want to give?
The target has been fixed at a total target from 1 to 19 years. It is 1 crore 46 lakhs 49,623 total number of beneficiaries. And we have women in reproductive age group of 20 to 24 years. With those who are non-pregnant and non-lactating, that is 17 lakhs 73,187.
Okay. Ma'am, what message you want to give?
I just want to give that message that the prevalence of anemia is quite high in our state, which we are trying to combat. And I request all the parents, all the young adults, whether they are suffering from anemia or not, they should come forward and take this albendazole tablet, which is being given free of cost to everyone. That is our first step in combating anemia and other nutritional deficiencies. They should come forward spontaneously and start taking this albendazole tablet from our centers in their schools, and wherever they are, they can go to the Anganwadi centers, VHSNDs, and take this tablet without any inhibition and without any suspicion.
Madam,
That is what-
how do you ensure 100% basically in rural area implementation of this program?
Because we have been making awareness programs for the last few years, so everybody knows the date. The date has been fixed by Government of India. It is given all over India on August 10 and February 10. So everybody is aware that this program is running. We are also conducting sensitization sessions in schools and colleges, so they know that where the tablet is available and how to take it.
There is a potential side effect. What is the concern between the parents?
Yes, all drugs are potential side effects, but when we consider the number of tablets that is consumed by the beneficiaries, not only during this program but also in our clinical practice, the side effects are considered minimal. At present, it is considered one of the safest medicine in our clinical practice.
What is the long-term strategy for DO society in long-term?
Long-term strategy is we should know what is our nutritional status, how to have a healthy life, how to take. We have a eat right vision, where we sensitize people, but what to take. So what to take during our daily diet instead of this fast food and the junk food that the young adults are addicted now. They should take a sufficiently nutritious diet, at least one plate of green vegetables, high protein diet with milk or any non-veg food, and they should maintain their nutritional status. So everybody should access all the information that is available during the different programs that we are conducting, and they should be aware what is their nutritional status and what food to take, and they should address that nutritional deficiency, especially anemia, which is affecting our young population, which is affecting the production capacity of our people, and which is also, as the young people are aware, the mental ability of the young people and their performance in schools and colleges.